Per exam review, Canadian Practical Nurse Practice Test, 35 hardest questions. Question 1. A practical nurse is caring for a Japanese-Canadian client who is terminally ill. The family is very emotional. What is the most appropriate nursing action? Restrict the number of family members visiting at one time. Inform the family that emotional outbursts should be avoided. Make arrangements so the family members can visit together. Contact the physician regarding the family's behavior. Cultural competence involves facilitating family support and respecting grieving processes within the client's cultural context. Question 2. A nurse is providing care for a client with COPD receiving oxygen via nasal cannula. Which flow rate should the nurse expect? 1 to 2 L/minute, 5 to 6 L/minute, 8 to 10 L/minute, 12 to 15 L/minute. In COPD patients, high oxygen concentrations can suppress the hypoxic drive to breathe. Therefore, low-flow oxygen, 1 to 2 L/min, is typically maintained. Question 3. Which statement best describes evidence-informed practice? Trialing untested research findings in a clinical setting. Promoting advanced assessment skills through intuition. Integrating research findings with clinical expertise and client preferences. Obtaining government funding for hospital-wide research. Evidence-informed practice is the integration of the best available research evidence with clinical expertise and patient values. Question 4. A nurse finds a client sitting on the floor. The client states, "I slipped." How should this be documented in the incident report? Client slipped and fell, no injury noted. Client found on floor and stated, "I slipped." Physician notified, assessment completed. Incident occurred due to wet floor, client fell. Client was found on floor by nurse, no injuries apparent. Incident reports must be factual and objective, including what was observed and what the client stated, as well as the follow-up actions taken. Question 5. Which stage of the normal grief reaction is typically experienced first? Acceptance, anger, shock and denial, bargaining. According to the Kubler-Ross model and general grief theories, shock and denial are often the initial reactions to significant loss. Question 6. A nurse educator explains the use of a standardized pain scale. This adherence promotes which intellectual standard? Depth, specificity, consistency, relevance. Consistency ensures that the same measurement tool is used across different assessments, allowing for reliable comparison of pain levels. Question 7. During a change of shift report, what information is most important to communicate? The client's favorite TV shows. A summary of the client's life history. Significant changes in the client's status during the shift. The nurse's personal opinion of the family. Reporting should focus on objective data, significant changes, and immediate needs for the next shift to ensure continuity of care. Question 8. A 2-year-old child requires an intramuscular injection. Which site is the preferred choice? Dorsogluteal, deltoid, vastus lateralis, ventrogluteal. The vastus lateralis is the preferred site for IM injections in infants and toddlers because it is the most developed muscle at that age. Question 9. A patient taking inhaled corticosteroids should be instructed to rinse their mouth to prevent which condition? Gingivitis, oral thrush, candidiasis, dental caries, halitosis. Rinsing the mouth after using a steroid inhaler removes residual medication, reducing the risk of developing a fungal infection like oral candidiasis. Question 10. A client with a stage 3 pressure ulcer on the right ischial tuberosity also has COPD. What is the most appropriate position? Right side lying, left side lying with pillows, prone, supine with knees elevated. Positioning should relieve pressure from the ulcer, right side, while considering the respiratory needs of a COPD patient, elevated or side lying. Question 11. What is the primary purpose of the Canadian Practical Nurse Registration Examination, PRA? To rank nursing students by academic achievement. To ensure entry-level nurses meet the standards for safe and ethical practice. To provide a basis for salary negotiations. To evaluate the curriculum of nursing schools. The PRA is a licensure exam designed to protect the public by ensuring only competent practitioners are registered. Question 12. A nurse observes a colleague documenting care that was not provided. What is the nurse's professional responsibility? Ignore it to maintain a good working relationship. Report the observation to the nurse manager. Correct the documentation themselves. Wait to see if the client's health is affected. Professional standards require nurses to report unethical or dishonest behavior to ensure client safety and maintain professional integrity. Question 13. Which lab value is most critical to monitor for a patient receiving high-dose furosemide? Sodium, potassium, calcium, magnesium. Furosemide is a loop diuretic that can cause significant potassium depletion, hypokalemia, which may lead to cardiac arrhythmias. Question 14. A client is scheduled for surgery and expresses fear about the procedure. What is the nurse's best response? Don't worry, the surgeon is the best in the province. I will get you some medication to help you relax. Can you tell me more about what is making you feel afraid? Everything will be fine. Many people have this surgery. Therapeutic communication involves open-ended questions that encourage the client to express their feelings and concerns. Question 15. Which of the following is a symptom of hypoglycemia? Extreme thirst, fruity breath odor, diaphoresis and shakiness, frequent urination. Hypoglycemia, low blood sugar, typically presents with sympathetic nervous system activation, including sweating, diaphoresis, tremors, and tachycardia. Question 16. When assessing a client's pulse, the nurse notes it is irregular. What is the next action? Document the finding. Notify the physician immediately. Assess the apical pulse for 1 full minute. Recheck the pulse in 15 minutes. An irregular peripheral pulse should be followed up by an apical pulse assessment for 60 seconds to accurately determine the heart rate and rhythm. Question 17. What is the priority assessment for a client who just returned from a cardiac catheterization? Bowel sounds, ability to void, neurovascular status of the affected extremity, dietary preferences. The priority is monitoring for complications such as hemorrhage or arterial occlusion at the insertion site by checking pulses, color, and temperature. Question 18. A patient with dementia becomes agitated in the evening. This is commonly known as dawn phenomenon, sundowning, aphasia, presbyopia. Sundowning refers to increased confusion, agitation, and restlessness in patients with dementia during late afternoon or evening. Question 19. Which of the following is a common side effect of opioid analgesics? Diarrhea, hypertension, constipation, insomnia. Opioids slow down gastrointestinal motility, frequently leading to constipation. Question 20. In the context of PN practice, informed consent is primarily the responsibility of the practical nurse, the patient's family, the practitioner performing the procedure, the hospital administrator. While nurses witness the signature and verify the patient's understanding, the primary responsibility for obtaining informed consent lies with the practitioner performing the procedure.